This is a video to tell you about some of the different types of food we might recommend you enjoy. This keeps you as safe as possible when eating. The speech therapist will do a thorough assessment and look at your swallow. They'll talk to you about what foods you like and don't like, and they'll work with you to create some recommendations just for you about all the things you can eat safely and enjoy. It's really important to follow the guidelines and not change anything. Have a chat to your GP or speech therapist if you think something's changed or you've got any questions or worries. The guidelines are there to keep you as safe as possible. There are a few different types of diet a speech and language therapist might recommend. The first one is a normal diet. That means you can eat anything you like. You can have a steak, a roast dinner, whatever you fancy. The next one is called a texture E diet, or a fork mashable, you might hear it called. This is a bit different. It's made so that you can get a fork through it easily. You can mash it with a fork. Meat is smaller than 1.5 centimetres. It has a thick, smooth sauce. Nothing's hard or crunchy or stringy. It's all quite soft and tender, something like a cottage pie or a fish pie. This stays together in your mouth and it's nice and easy to chew. It doesn't need much work. The one after that is called a pre-mashed or texture D. This has already been mashed for you with a fork. This might be something like a fish pie that's been mashed really well with a fork. It's bound together or held together with a thick, smooth sauce. It doesn't need any chewing and it slips down, hopefully, quite easy, and it should stay together in your mouth for you. The one after that is a texture C or a thick puree. This might be something like a thick, smooth soup, a thick, smooth porridge, or Weetabix that's been really well soaked, no loose milk at all. This is designed to need no chewing at all. It should stay together in your mouth and it should slip down easily for you if you have difficulties that mean this will help. It's really important to puree each bit of your meal separately. You want to be able to see what you're eating, so make sure it looks as appetizing as possible and you can tell which bit's the chicken, which bit's the meat, which bit's the potatoes, which bit's the vegetables, for example. If you need to, and your speech therapist has recommended it for you, you can add a bit of thickener in to help keep it all together. The one after that, the last one, is a texture B. This is a thin puree. It's not too thin. You can stand a small plastic disposable spoon upright in it, but it might be something like a smooth yogurt. There are some foods that we might ask you to avoid, even if you're on a normal diet. These are the high-risk foods, and there are a few main groups that I'm going to talk about. The first one are hard, sticky foods or long, round foods that might block your airway. So things like a marshmallow, a boiled sweet, also sausages or grapes. These can get stuck and cause you to choke. The next group are dry, crumbly foods like a hobnob, a cracker, a biscuit. All those crumbs will spread out in your mouth. When you start breathing again after you swallow, you could suck them in. They could go down the wrong way, make you cough or make you poorly. There's what we call floppy foods, things like cabbage, cucumber, lettuce. If you don't chew those down really well, they can get stuck to the skin of your throat or mouth. They could block your airway or be really difficult for you to swallow. Lastly, there's mixed texture foods. So I mean things like cereal and milk, I mean things like melon, I mean things like soup with bits in. Your brain and your swallow have to do two different things at once with these. So they have to chew the food, but they also have to deal with the liquid. This can be too hard for many people. One of the reasons a fork mashable diet might be recommended is because there's no loose liquid. There's nothing different that you would have to do at the same time. Try and make sure whatever you're eating, it looks as appetizing as possible. Think about serving it on a nice plate with a pretty napkin, taking your time to make it look nice so you'll enjoy it all the more. If you think eating is still difficult, do contact your GP or speech therapist for some more help and advice. If you're worried you're not eating enough, you could ask them about a referral to a dietitian who would be able to give you some more ideas about good things to eat to keep you healthy, however you need your food served. Your local speech therapist will also have ideas and tips on how to puree food and what sort of food works well for each of the different recommendations.